Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider. Preventing HIV and AIDS. Introduction. AIDS is a life-threatening disease caused by the human-immunodeficiency-virus, or HIV. HIV makes it difficult for the body to fight off infections. Millions of people around the world have HIV, or AIDS. There is no cure for AIDS, but there are treatments that can slow down its progression. This program is about HIV and AIDS. First, it describes the HIV infection and how that turns into AIDS. This program stresses risk factors, screening, and prevention. Symptoms and treatment are also reviewed. What is HIV? HIV is the virus that causes AIDS. When a person has HIV, it means the HIV virus is in his or her body. When a person has AIDS, it means HIV has made it so the body cannot fight off infections. The person may get infections or tumors that the body can no longer fight off. HIV enters the body through the blood, semen, vaginal fluid, or breast milk from an infected person. The body depends on the immune system to fight infections the same way it depends on the digestive system to digest food. The immune system also keeps some types of cancers from taking over the body. With no immune system, a person would die from a simple infection such as a cold or flu. If we think of the immune system as an army fighting infections, white blood cells are the soldiers. They are called lymphocytes. There are special lymphocytes called CD4 helper lymphocytes. They coordinate the immune system's attack on foreign organisms. As HIV infects the body, it destroys CD4 helper lymphocytes by using them to make copies of itself. This causes the immune system to not work well. HIV stands for human-immunodeficiency-virus. Immuno means the immune system, and deficiency means lacking. Lymphocytes and HIV fight each other for years. Each day the body makes billions of CD4 cells and the HIV uses them to make even more of its own copies. In most people, the HIV eventually wins the battle. However, medications can make it difficult for HIV to win. After a person is infected with HIV, the number of CD4 cells goes down. A normal count is 500 to 1500 per cubic millimeter of blood. When the count drops below 200, the body's immune system cannot work well at all. With a CD4 count below 200, a simple infection could cause a lot of trouble because the body cannot fight it off. A person has AIDS if he or she has HIV and the CD4 helper lymphocyte count is 200 or less. AIDS complications. AIDS stands for acquired-immunodeficiency-syndrome. This means a disease caused by a weak immune system. Once HIV turns into AIDS, the risk of death is much higher. Even so, the risk varies a lot from patient to patient. Some AIDS patients die shortly after being diagnosed, while others live many years. Without treatment, a person with AIDS could die from a simple infection. Viruses, bacteria, fungi, and parasites can cause infections. Infections caused by bacteria include tuberculosis, TB, Mycobacterium avium complex, MAC, salmonellosis. Infections caused by viruses include cytomegalovirus, CMV infection, viral hepatitis, human papillomavirus infection, progressive multifocal leukoencephalopathy, PML. Infections caused by fungi include candidiasis, cryptococcal meningitis. Infections caused by parasites include pneumocystis carinii pneumonia, PCP, toxoplasmosis, cryptosporidiosis. HIV also makes the body helpless against certain types of cancer. People with HIV are more likely to develop cancers such as Kaposi's sarcoma, cervical cancer, non-Hodgkin's lymphoma.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Infection. Anyone can get HIV. A person with HIV can give it to another person through blood, semen, vaginal fluid, or breast milk. HIV is not transmitted through saliva, sweat, spit, tears, air, or insects. There are different amounts of HIV in various bodily fluids. The highest amounts of HIV are in blood. The most common way to get HIV is through unprotected sex without a condom. If a person has HIV, the virus is in their blood and semen or vaginal secretions. It could enter another person's body through tiny cuts or sores on the skin or the lining of the vagina, penis, rectum, or mouth. But even condoms are not 100% effective at preventing HIV. If the condom breaks, for example, the infection could still pass from one person to the other. Another common way of getting HIV is by sharing a needle or syringe with someone who has HIV. HIV is transmitted through blood, semen, vaginal fluid, and breast milk. HIV is not transmitted through saliva, sweat, spit, tears, air, or insects. The amount of HIV in your blood can range from undetectable levels to millions of copies. This is known as the viral load. The higher your viral load, the greater the risk of spreading HIV to others. Having a low viral load reduces this risk. If you have maintained an undetectable viral load, you have effectively no risk of spreading HIV to a partner during anal, vaginal, or oral sex. But you can still spread the virus through shared drug needles or syringes, breastfeeding, and childbirth. Open-mouth kissing with an infected person is not recommended. If there are any cuts or sores in the mouth, blood exchange could pass the virus to the uninfected person. Exchange of only saliva is not enough to transmit HIV. Sub-Saharan Africa is the area of the world most severely affected by AIDS. AIDS is also growing in the Caribbean, Asia, Eastern Europe, and Central Asia. If you have to have a blood transfusion in these areas, have an HIV screening when you return home. Symptoms. The symptoms of HIV and AIDS vary from person to person. This section discusses the symptoms according to the following stages. When a person first gets HIV, early HIV stage, late HIV stage, early AIDS stage. Most people do not notice if they get HIV. Some people who get the virus may develop a brief flu-like illness 2 to 6 weeks after becoming infected. However, since these symptoms are similar to a cold or flu, they go unnoticed. During the early stages of HIV, a battle rages between CD4 cells and HIV for 8 or 9 years without being clinically noticed. Most people with HIV do not have symptoms in the early stages. Eventually, this stage ends with mild infections or chronic symptoms, such as cough, diarrhea, fever, shortness of breath, swollen lymph nodes. This may be the first sign of HIV. Weight loss. During the late HIV stage, more serious symptoms may start to appear, such as persistent, unexplained fatigue, soaking night sweats, shaking chills or fever higher than 100 degrees Fahrenheit for several weeks, swelling of lymph nodes for more than 3 months, chronic diarrhea, persistent headaches. AIDS develops when an infected person starts having opportunistic infections that do not usually infect people with a healthy immune system. The signs and symptoms depend on the type of infection. People with untreated HIV may develop AIDS in less than 10 years, but in the United States, most people who receive treatment for HIV never develop AIDS.
Diagnosis.
The Centers for Disease Control and Prevention, CDC, in the United States recommends an HIV screening test for all people between the ages of 15 and 65. Women who are pregnant should also be tested. There are a few types of tests, and many of them must be repeated to confirm a diagnosis. Some tests can be performed at home. After diagnosing a person with HIV, the healthcare provider uses a test to measure the amount of HIV in the blood. This is called the viral load. The higher the viral load is, the faster AIDS will probably develop. Viral load determines the suggested treatment.
If you engage in high-risk behavior, such as unprotected sex or sharing needles for intravenous drug use, get tested for HIV every 3 to 6 months. Your test can be confidential or anonymous. Most states require that you sign a consent form before having an HIV test. This guarantees that nobody can check you for HIV without you knowing. A confidential test means that if you test positive, the results will be reported to your state health department, but will not be given to anyone else without your permission. An anonymous test is where your name is not recorded, and no one besides you can ever learn the test result. Not all states have anonymous tests, but most provide confidential tests.
If you are pregnant, you should still get tested even if you think you are not at risk. If you are HIV positive, treatment with antiretroviral drugs during your pregnancy could greatly reduce the chances of you passing the infection to your baby.
Treatment.
Right now, there is no cure for AIDS, but treatment is available to slow the progression of HIV to AIDS and improve quality of life. HIV patients can now live long, productive lives. The treatment for AIDS focuses on suppressing the growth of the virus and improving the patient's quality of life. This is called antiretroviral therapy, or ART. The levels of HIV in the blood, or the viral load, is tested at the beginning of treatment and then every 3 to 4 months during treatment. In some cases, the viral load is tested even more often. Drugs used for treatment can slow down or prevent the virus from reproducing. Other drugs can keep the virus from entering healthy cells or from being incorporated into the patient's genetic material.
Prevention.
There is no vaccine to prevent HIV infection and no cure for AIDS, but if you are at high risk of getting HIV, medication may lower the risk. You can help protect yourself and others from infection by following 5 simple rules.
Rule number 1. Do not share needles or syringes. Regardless of what they are used for, injecting drugs, steroids, vitamins, for tattooing or body piercing, they should not be shared. Also, do not share equipment used to prepare drugs for injection.
Rule number 2. Do not have unprotected sex. A surefire way to avoid getting sexually transmitted infections is to be in a long-term, mutually monogamous relationship with a healthy partner. For people whose sexual behaviors put them at risk for STIs, always using a male latex condom correctly can reduce the risk. Remember, no form of protection besides abstinence works 100% of the time. The use of a dental dam or condom during oral sex can decrease the risk of HIV transmission.
Rule number 3. Do not share razors or toothbrushes. Sharing either of these creates the possibility of contact with blood. Rule number 4. Avoid contact with other people's blood.
Rule number 5. Do not breastfeed if you have AIDS or are HIV positive. If you are pregnant or think you might be, talk to a healthcare provider or your local health department about being tested for HIV. If you have HIV, treatments are available to help you and reduce the risk of passing HIV to your baby.
If you like this video, please like and share.
For similar videos, subscribe to our channel.
Summary. AIDS is a life-threatening disease caused by the human-immunodeficiency-virus, or HIV. HIV makes it difficult for the body to fight off infections.
Anyone can get HIV. HIV spreads from an infected person to another person through blood, semen, vaginal fluid, and breast milk. HIV is not transmitted through saliva, sweat, spit, tears, air, or insects.
The most common ways of getting HIV are through sexual activity and sharing needles or syringes. It can take many years after being infected with HIV before AIDS symptoms appear. In many cases, HIV never turns into AIDS. There is no cure for AIDS, but there are new treatments that can slow down the progression of the disease and improve the patient's quality of life. There is no vaccine to prevent HIV, but if you are at high risk of getting HIV, medication may lower the risk. Thank you for using Explain.